11:39, welcome back. As May draws to a close, a reminder, it is American Stroke Month. Strokes can happen to anyone at any age. Having a stroke puts you at a higher risk also for a second one. And most adults here in the U.S. don't know the stroke warning signs, but it can be very treatable if you recognize those symptoms early. That's the key here. That is why we have Dr. Chiwon Hahn with HCA Virginia here on the Midday Show to break down what we need to know. Thank you so much for being here, sir.
Thanks for having me.
Nice to see you. Appreciate it. So as we talk about stroke awareness, why is it important to raise awareness of these stroke warning signs?
Well, stroke is very preventable, so it's good for people to know how to minimize the risk of having a stroke. And also, if it's treated quickly, a lot of the bad things that can happen after a stroke can be ameliorated quite a bit.
Yeah. Talk to me about, how would somebody know if they are experiencing a stroke, or how would I know if I'm looking at somebody to know, hey, maybe we're having an issue here or something?
We like to use the acronym FAST, F-A-S-T. F is for facial asymmetry. So if your loved one or friend, if they have facial droop on one side, that would be a sign of a stroke. Mm-hmm. A stands for arm weakness or any type of extremity weakness, especially if it's on one side or the other. S is slurred speech, mm-hmm. which we all could recognize. And then T stands for time. Time is of the essence with a stroke. We like to say time is brain tissue, so the faster you can get to a hospital and get treated, you can really minimize the effects of a stroke.
I was going to say, why is it important to respond quickly if someone is experiencing those stroke warning signs? I mean, we talk about time, but mm-hmm. Seconds can make a difference in all of that.
Yes. So a stroke, remember, there's some confusion. A stroke means that your brain is having a problem. A heart attack is your heart's having a problem, but the risk factors are fairly similar. Mm-hmm. The brain doesn't do well if it's not getting blood flow for very long. So we encourage people to call 911 if we think they're having a stroke. And calling 911 is actually faster than driving yourself to the hospital because it activates a whole stroke alert team that hospitals have nowadays. And so everyone will be there waiting for you when you get there, and you'll get evaluated and treated more quickly. And
with calling 911 too, I have to assume the paramedics and stuff who arrive at your home can also begin to help you a little bit, at least at that point in time as well.
Absolutely.
And then talk to me, what's important to know about stroke prevention? I guess maybe a final takeaway for people as we are in this month.
Mm-hmm. Well, similar to heart disease and heart attacks, it's the things we all know with common sense. So obviously try to have a healthy lifestyle, mm-hmm. be active, aerobic exercise is good, maintain a healthy body weight. If one has diabetes or high blood pressure, try to control your blood sugars and your blood pressure well, and of course, try not to smoke cigarettes.
Yeah, no, all very good advice. Mm-hmm. And then if a viewer wants to learn more information, if they need to figure out, hey, I'd like to learn more about the signs of a stroke or what I should be doing, where would you point them to?
Mm-hmm. You can go to heart.org and get all that information. And it's really, denial's a powerful emotion, mm-hmm. and we see even cardiologists having chest pain thinking they might be having a heart attack, and no one wants to get out of bed at 2 in the morning, and it's a lot easier to stay at home in your warm bed, but you have to just be proactive and realize the symptoms and go get treated.
And learn to act fast, as
yes.
you guys say.
Yeah.
So, all right, thank you so much, Dr. Chiwon Hahn with HCA Virginia. Thank you so much for coming in and being here today and breaking down these very important warning signs for stroke. So thank you.
Thank you, Henry.
All right, time now for a check on the forecast.